Hello everybody, and welcome to another Let's Talk Upper Cervical video. I have with me Willis, and he is here to talk about his story on how he became a patient of Dr. Scott Baker's here at the Upper Cervical Health Center in Spartanburg, South Carolina. And thank you so much for being here.
Thank you.
If you would just tell about where your problem started early on in life.
Do we have enough time? No, I'm just kidding. About 30 years ago, when I was in my mid-teens, I had a couple accidents, and back then they didn't really treat those type of injuries, the upper cervical area. Oh, they put you're familiar with the neck brace, or what they used to call, lawyers call it, and they put that on you for a few weeks and make sure everything's all right. But they didn't know really how to treat it, and I started getting some strange symptoms that were just mind-boggling to doctors. And you have to remember, back then I went to a lot of different physicians to find out what was wrong. I was just a teenager, and my mother being a nurse, she would have me to go to different areas to see what was wrong, and different doctors to see what was wrong. Never could pinpoint it. Mm-hmm. And different symptoms would appear, and they were almost like phantom symptoms. I mean, it would be anxiety, and you'd have stomach trouble, and almost like a child has colic or something. It was just, a horrible condition. Back pain, leg pain, what they used to call sciatica. I guess they still call it that now, where your legs and stuff hurt, from your back all the way down your legs. And when I went to the military, they accepted me to go into the military. The symptoms kept getting worse. I'm thinking, goodness, we've got to figure out what this is. None of the medical doctors there knew what it was. I mean, they check you from head to toe and said, well, you're just an anxious person. Here's this prescription. Boom, there you go. Right. You take that and it does nothing for you. It's like taking a glass of water. And I eventually just left all that, and I thought, you know what? Why should I do that? Why should I alter the chemicals in my body to fix a problem when it's just masking a problem? Mm-hmm. We need to get to the root of that. And I never could find a way to get to the root of it. Several years ago, I tried a chiropractor. I called my pastor, and he recommended that chiropractor would be great. They don't issue any type of medicine or anything like that. They want to get to the root of the problem. Mm-hmm. And so I did, and they helped. They helped as much as they could back then. There have been so many advances in it now that I didn't realize until I met Dr. Scott Baker that the problem could actually be fixed. Right. And instead of just temporarily fixed, but actually fixed. And I was at work one day, and I didn't know him. I didn't know him from anybody in the store. He come in one day, and we were talking, and he saw me walking to get something. He said, you know what? He said, is your back hurting? I said, yeah, every day. It hurts every day. Don't worry about it. Right. He said, yeah, but it doesn't have to. I said, it has been for 30 years. He said, yeah, but it doesn't have to. I couldn't understand what he was trying to get at, I mean, someone comes in and says, hey, it doesn't have to hurt anymore, and you're like, well, of course it does. I've been this way for 30 years. It has to hurt. Right. I mean, you think that because the pain has trained your mind to think, yes, I wake up and I hurt. That's what normal people do. Mm-hmm, mm-hmm. And it wasn't the case, though. And but for 30 years, yes, I also want to mention, another symptom that I had that others may have, and they just don't know that it could be fixed, and that was constant anxiety. But not only that, but just an absolute overwhelming thought process of everything at one time going on off in your mind. And the only way I can explain it is like having 1,000 different channels, cable channels on in your mind at the same time with the same volume, and you're looking at everything. And you just can't concentrate like that. I mean, there's so much noise. I call it noise because it's inner noise. I mean, it was amazing. And when I come to see Dr. Baker, I told him about that. He said, you know what? He said, I had a similar experience with that. I said, this is too good to be true. No, I thought I was the only one, And he said, no, several people. I mean, a lot of people have that issue. And then he said, I had the same issue. What you're describing is what I had. Mm-hmm. And he said, it's just a simple, out of place, bone in your neck, and that's the way he explained it then, because I didn't understand the terminology. Was when he, they're not going to give you medical terminology, right off. So he said, yes, it's a simple misalignment. That's all it is. And I didn't know what a subluxation was, so yeah.
Right.
And he says, well, let's do some x-rays and find out. So he did. He said, there it is. And sure enough, when I looked at it on the x-ray, I mean, the very first vertebrae is turned over this way and shoved over, and you can plainly see that it's just touching the brainstem and everything.
Mm-hmm.
I would say within a split second after the adjustment, it was all gone.
Wow.
Every bit of the traffic for 30 years, every bit of the anxieties, would just disappear. I'm thinking, that's like a light switch.
Mm-hmm.
How can that happen? I was totally befuddled. I was amazed. He says, well, go lay down for a while. Lay down for a little while. And I got back up, and I said, well, is this what normal is? Because I couldn't remember what normal is. You got to remember, 30 years.
Right.
So I couldn't remember. I don't know what normal is. As an adult, never did know what normal was. So for the last 2 months, I know what normal is. I can sit down and have a conversation with somebody without talking over top of them, constantly interrupting them, because it was like an ADHD symptom, but it really wasn't.
Right.
I know what normal is now. I'll put it that way.
That's wonderful to hear. So what would you tell to others out there that may be experiencing the same sort of noise, in their head throughout the day?
Well, I'll tell them that drugs are not the answer. I don't believe in taking drugs. I don't believe in taking any type of medication. Never did. It's the same thing as if you broke your arm, you're going to go have your arm set in a cast until it heals. It's the same thing. If there's something out of alignment, just get it put back in. That's all. Then the body can heal itself. I would tell them and encourage them very much so that it can actually help. If a person has a mental disorder, of course it probably wouldn't, but I'm saying that, that my condition was caused by something physical. Mm-hmm. And most are. Probably 90% of those who are watching, they're probably, and I would just by my own experience, I would say 90% of the people out there watching that have those symptoms, it's probably not mental at all. It's probably something physical due to a subluxation occurring in the upper cervical area.
Well, I want to thank you for joining us for this video, and thanks for sharing your story. And to all of our viewers out there, thank you for watching, and please tune in next time for a video of Let's Talk Upper Cervical.